Well, hello and welcome to my Sunday morning coffee with Dr. Childress. Today, I'm going to be discussing the experiment of forensic custody evaluations that was conducted on parents and children in the family courts, and I'm going to kind of vent and rant on my immense frustrations with the low quality of mental health services in the family courts and what these monstrosity of things called forensic custody evaluations are. And so this is kind of for me, it's years of pent up frustration about the stupidity and the incompetence of the forensic psychologists as reflected in their custody evaluations. Um, and there are a couple things about the custody evaluations is that you parents in the court have no way of evaluating the professional quality of them. But as a clinical psychologist, I do. And they are absolutely awful. They are the worst thing. And I'll go into that, throughout this talk about how awful and how many ways they are awful. But it points out that there's no oversight or review of these custody evaluations, and it's an experiment. And I'll discuss that. And it's a failed experiment, and as a result, thousands of lives of children and their parents were destroyed by these people, and they're specific people. It's not a forensic psychology. No, there's forensic psychologists who developed this approach, and they, in my view, they need to be held accountable for their failed experiment and for some of the decision making they made along the way that was extremely problematic. So, yeah, today uh, is kind of indulgent on me to kind of vent some of my frustrations. And the important or key element to understand on this is that forensic psychology and in the family courts is an experiment. Okay, it never existed prior to about 1980. So we'll go into that. But first, let's start with the New York Blue Ribbon Commission here. This was an independent evaluation of the practice of forensic custody evaluations. So, the New York Blue Ribbon Commission on Forensic Custody Evaluations. And this is what an independent review of them found. And so, it's not just me talking about it, although I do talk about it. I know them extremely well. That it says that unfortunately, or ultimately, the commission members agree that some New York judges order forensic evaluations too frequently and often place undue reliance on them. Judges order forensic evaluations to provide relevant information regarding the best interests of the children, and some go far beyond an assessment of whether either party has a mental health condition that has affected their parenting behavior. Uh, And in their analysis, evaluators may rely on principles and methodologies of dubious validity. In some custody cases, because of a lack of evidence or the inability of the parties to pay for expensive challenges of an evaluation, defective reports can thus escape meaningful scrutiny and are often accepted by the court with potentially disastrous consequences for parents and children. Now, um, I absolutely 100% agree with that assessment, that there are many defective reports. That's my current role in the family courts. I'm a consultant to attorneys and to the parent clients in the family courts. Oftentimes, I'm asked to review custody evaluations that are defective. And in fact, what I'm going to do when I finish talking to you the rest of my day is I'm going to spend it in a custody evaluation that is defective, going through it line by line because the ignorance and incompetence is so dense. I can't do it like in chunks. I have to go through line by line on everything they say because it's every line they say is just extraordinarily problematic. And I'll explain a little bit more about that going forward. But I am the meaningful scrutiny. So I get to read them over and over. So I'm in a unique position in the family courts. No one else reads the number of forensic custody evaluations that I get to read because people bring them to me to read and say, "Look at this, Dr. Childress. Look at this. Is this okay?" And so I'm very well familiar. But the independent of me, we have an independent review from the Blue Ribbon Commission and found that they are extraordinarily problematic. So, by an 11-9 margin, a majority of the commission members favor elimination of forensic custody evaluations entirely. I am 100% in agreement with that recommendation, arguing that these reports are biased and harmful to children and lack scientific or legal value. Again, I am 100% in agreement with every part of that sentence. They are harmful to children and they lack scientific and legal value. At worst, evaluations can be dangerous, particularly in situations of domestic violence and child abuse. That's a scathing review. Um, and people constructed these. So there are people who are responsible for creating this monstrosity. These members reached the conclusion that the practice is beyond reform and that no amount of training for courts, forensic evaluators, and or other court personnel will successfully fix the bias, inequity, and conflict of interest issues that exist within the system. Again, I am in full and complete. So we have two reviewers, one, an independent blue ribbon commission. I had no input on them. So an independent blue ribbon commission on forensic custody evaluations looks at them and gives them a scathing review, critique. And then from another perspective, you have a consultant in the family courts who is a second opinion on these custody evaluations who reaches exactly the same conclusion. We need to get rid of them. They are the worst thing imaginable. Um, so then, oh, yeah, the forensic custody evaluations are a failed experiment in service delivery to a vulnerable population. Clinical psychology, diagnosis, and treatment needs to return to court involved custody conflict. Now, regarding a vulnerable population, let me speak about that for a second. That's a category within professional psychology of groups of people who, for a variety of reasons, are more vulnerable to exploitation or harm. And when we're working with a vulnerable population, the psychology professionals need take special precautions. There's special precautions around vulnerable populations to prevent their exploitation. And the best description I've heard of a vulnerable population is from the Canadian Ethics Code. So here's what the Canadian Psychological Association Code of Ethics defines as vulnerable relative to a vulnerable population. Refers to individuals or groups whose dignity, well-being, and best interests are more easily violated due to such factors as characteristics of the individual or group, such as a level of cognitive or emotional functioning, history of oppression. B, level of voluntary consent assent, such as serious consequences threatened if consent is not given. So that's applicable in the family courts. These parents have their voluntary consent to some of these treatment stuff overruled by the court's authority. And so they become a vulnerable population because of the court's involvement and the court's authority in their lives. And then C, that the interests of the individual or group compete with interests of more powerful individuals or groups, such as a claimant in an insurance company. And D, high risk of harm, like life changing decisions based on inadequate assessment. That is spot on to what we have in the family courts. So we have a high risk of harm because of the life changing decisions that the court has, and it's based on inadequate information from the forensic psychologist. And so the families in the family courts, because of their court involvement, represent a vulnerable population. If you look at the petition to the APA, that is still pending. They haven't given us an answer to 20,000 parents telling them about the ethical violations. There's three remedies on that. And the first remedy is just to put out a to put out a press release from the APA just supporting Standard 2.01, boundaries of competence, saying, just a reminder to everybody, the boundaries of competence applies to all psychologists in all settings. But they won't even do that. They won't even support their own ethics code when that would have a positive effect in the family courts, because they're controlled by the forensic psychologists. The forensic psychologists have infiltrated the power structures within professional psychology, and they are disabling the mental health response to the pathology in the family courts. There are specific people who are disabling the mental health response to the pathology in the family courts for their own financial and professional gain. I know who they are. They know who they are. You don't know who they are yet. I'm not going to tell you on this place because I'm trying to avoid getting in trouble, because they control the licensing boards. And so it's extraordinarily dangerous for clinical psychologists to be in the family courts. That's why none of them are here. And so you are owned by a particular group of ignorant, incompetent, stupid, lazy, unethical psychologists, and they own you, and they are exploiting you for the money and giving you just awful services. And no one's overseeing them. No one's stopping them. And Blue Ribbon Commission. Where is the oversight? Where are the licensing boards holding people, psychologists, to ethical standards of practice for competence? Nowhere to be seen. Why is that? Why is there no oversight of these forensic psychologists? Pull the string and find out. So but then on the APA petition to the APA, I also asked for them to change their official position statement on parental alienation to reflect that there's now a new description of it. It's not parental alienation. It's a shared persecutory delusion by a narcissistic dark personality. It's not a controversial thing. There is no controversy about dark personalities or narcissistic borderline or shared delusions or factitious disorder. There's no controversy about attachment pathology or the application of knowledge, cross-generational coalition. There's no controversy about any of that. So the APA needs to change its position statement on the pathology in the family courts away from made-up things and be grounded back in the established scientific and professional knowledge of the discipline. And that's what they should be using for their evaluation of the pathology in the family courts. But one of the things you'll notice in that remedy too is I noted that these families should be given the designation of a vulnerable population, and that should happen. That the American Psychological Association should formally designate families in the courts around custody conflict as a vulnerable population requiring specialized protection and specialized expertise to work in the field. And right now, there is no standards. For the clinical psychologists have all left because it's too dangerous. And so you only with the forensic psychologists. Now, when the clinical psychologists leave because it's too dangerous, the pathology is dangerous, the court's dangerous, the court interferes with the treatment, so treatment's not going to be effective because the court's going to mess with it. And so we know that as a clinical psychologist, we work with the family courts, the court's going to mess with, because my first case, okay, I come out of clinical director, I'm entering private practice, I get an email from a minor's counsel, says, we're looking for a therapist for this family. Would you submit your vita for that? Now, normally I would just toss that in the trash and say, no, I don't work on conflict divorce, which is what all clinical psychologists say. But here I'm an old guy. I'm figuring I've worked with every pathology, and this is narcissistic borderline personality. I know what it is. All clinical psychologists know what you got in the family courts: narcissistic borderline personality, all activated. The splitting and the high conflict people. And that's all. No, we don't want to work with that. They're very retaliatory. They're delusional. They make out false allegations if you try to stop what they're doing. Important to understand about this pathology. No other pathology tries to stop us from healing it, but this one does. And so the narcissistic borderline dark personality parent needs to make the child pathological. That's part of their pathology is they're using the child as a regulatory object. They need to make that child pathological. So, but as a clinical psychologist, we're trying to stop that. So if we come in and try to stop that, the pathological parent is going to retaliate against us. Now, how do we remain safe? How do the forensic psychologists remain safe? They don't try to stop it. Easy peasy. If you don't try to stop the pathology, then you remain safe as a professional. So that's their risk management response is they just don't try to stop it. But all clinical psychologists know that if we come over here and try to stop it, it's too dangerous for our license. So if that's the case, who comes to the family courts to work? If it's so dangerous that all good clinical psychologists won't work here, who comes to the family courts? The lowest of the low. The one they come here because they don't need to know anything. They don't need to be competent. They don't need to really do anything. I'll describe that in a second. And they get paid lots of money in the 6 to 9 months, and it's just $20,000, and for having an opinion and going through this process, it's easy peasy. So you get the lowest of the low, the ignorant, the incompetent, the unethical, and they're only here for the money. That's it. That's the only motivation they come here for. Because if you're motivated to be a good psychologist, you don't come to the family courts because the court's going to interfere with your treatment and it's not going to be effective over here. So we go work with ADHD or autism, someplace that's more rewarding and fulfilling, and it's not as dangerous. So in the family courts are filled with the lowest of the low in terms of the mental health people that are over here. So court involved families meet criteria for being a vulnerable population requiring special professional safeguards to guard against possible exploitation of their vulnerability. That needs to happen. The important thing for all parents to understand, and everybody, the clinical psychologists, the APA, everybody, legal professionals, everybody to understand is that forensic custody evaluations are an experiment in service delivery, that they never existed before the 1980s. The activity of forensic custody evaluations did not exist prior to the 1980s. They have no history. They are a new made up thing. And it's made up by a group of people, a group of ignorant people, a group of stupid people with no oversight and no challenges. There was no, it's a group think. If you know anything about group think from the 1960s and, Kennedy and the Cuban Missile Crisis and stuff, and Bay of Pigs, it's this mindset that gets into groups where they all agree with each other and there's no challenges to their thinking, and it makes extraordinarily bad decisions. That's the Bay of Pigs for Kennedy. Whereas if you get discrepant opinions and challenges, you get better decision making, which was the Cuban Missile Crisis. So all that groupthink from the 60s, and it's expanded in the research. All of that needs to be applied to forensic psychology because they're in this groupthink mind of financial exploitation of families. They have no motivation to change because they're making money being ignorant and incompetent. There's no motivation to solve anything. There's motivation to keep things exactly as they are, dysfunctional. So clinical psychology, though, has its foundations going back all the way in history on medicine. The foundations of clinical psychology is in healthcare. Diagnosis guides treatment. So that's an established domain to apply to the pathology in the family courts. Forensic psychology is a new made up thing. Forensic custody evaluations are a new approach to service delivery that does not diagnose and does not treat the pathology. They do something different. Well, what they did failed. Their experiment failed. The origins of forensic psychology, Stahl and Simon, they wrote the book on how to conduct forensic psychology. So I think they should be held accountable for the failure. They're the ones who are instructing on how to do this. They're the ones who create the model. They have a book on how to do the model. So if it's a failed model, boom, they should be held accountable for the failure. This is what they say. It was not until 1994 that the APA recognized the importance of formalizing guidelines for child custody evaluations when it published its first set of guidelines. And it was not till 2010, 16 years later, that these guidelines were revised. So before 1994, we didn't even have guidelines for doing any of these things. This is not something that's established. It's a new thing that it created off of their own imaginings. These forensic psychologists were given permission, just not overtly, just because of the lack of care, the apathy of clinical psychologists. We wanted to get out, but we can't abandon the families. We have to give you something because it's too dangerous to us. We don't want to work in the family courts. So we created a special group of psychologists just for you. We call them forensic psychologists, and then we walk away. We say, do whatever you want, keep yourself safe. We know it's dangerous. The way they keep themselves safe is they don't treat anything, they don't fix anything, and they don't interfere with the pathology. And then they wind up just exploiting the families. Now, there's no clinical psychologists out in the real world who know what's going on over here. We thought the forensic psychologists are psychologists, they got it covered, right? And we just stopped paying attention to what's happening over here. So there's no oversight. We gave them permission to do whatever they want. They're on the licensing board, they self-review. And no one challenges their approach or way of thinking, which is awful, awful, awful. They made bad decisions throughout coming up with their new experimental custody evaluation stuff. And that's why they do it. Go through line by line and take them apart. But that's what everybody needs to understand. This is a new thing, and it's a different thing than what all the rest of doctors do. These doctors do something different, and they just make it up. It's not based in anything except their own imaginations. Now, listen to this. Far from mature. Stahl and Simon, 2013. As a formal and organized field, forensic psychology has entered its adolescence, but it's far from mature. 2013. Now you go back and you say 1990, they got their first guidelines. A decade later, they're still in their adolescence. They're still far from mature. Then look at 2020, almost a decade later. Same thing. As a formal and organized field, forensic psychology has entered its adolescence, but it's far from mature. I am sorry, but they are failed experiment. If you've got 40 years and you're still in your adolescence, you still don't know what you're doing after 40 years, and you're still far from mature, you're done. You're done. You're failed. It's a failed model of service delivery to a vulnerable population, and it needs to end. Blue ribbon commission. I agree. Let's eliminate forensic custody evaluations entirely from the family courts. But the problem is you're going to wind up with no competent mental health services because clinical psychologists haven't been here for 40 years, and you've been given to this incompetent, ignorant, stupid, unethical group. And I blast them forever and ever, and they can't defend themselves because it's all true. I'll debate it. Anytime, anywhere. Put a forensic psychologist one side, me on the other. The role of forensic versus clinical psychology in the family courts. There's your debate topic. The role of forensic versus clinical psychology in the family courts. I'll take clinical psychology, find a forensic psychologist to support what they do. You will find none. That's my guess. You will not find anyone who is willing to support what they do, because there's no support for it. I'm a psychologist. I know where it is, but you folks that aren't psychologists, you look at it and you don't know what they're doing. You don't know what they're giving you. You don't know what they should be giving you. I know what they should be giving you, and I know how bad it is. So, yeah. Stahl and Simon, the difference between forensic and clinical. Because forensic psychology is truly a new field, it's a new field in 2013. Many child custody evaluators, having been trained only in the clinical tradition, bring to their work what we call a clinical mindset rather than a forensic mindset. See how they're separating themselves off? They do something different than what the clinical psychologists do. Clinical thinking and the clinical mindset are no longer thought to be appropriate approach to forensic psychological work, no longer thought to be appropriate by them. Okay. It's totally appropriate. They are wrong. Stahl and Simon are 100% wrong when they assert that the clinical mindset is no longer appropriate. And I will assert that the forensic psychological mindset is harmful to children. Blue Ribbon Commission. Results in defective reports. Blue Ribbon Commission. And should be eliminated entirely. Blue Ribbon Commission. Stahl and Simon are 100% wrong. So who's the oversight on Stahl and Simon now? Who challenges them except me? Is there any discussion with the APA about challenging this belief system, this wrong belief system? Is there any discussion within the AFCC that this is a wrong mindset? The forensic mindset is a dangerous mindset. Blue Ribbon Commission. It is harmful to children. Blue Ribbon Commission. It lacks scientific and legal value. Blue Ribbon Commission. Who's challenging Stahl and Simon in the AFCC? Who's challenging Stahl and Simon in forensic psychology in the APA? No one. That's your group thing. They're just letting them do this. Insane. And it's child abuse. And if you believe a shared delusion, you become part of the shared delusion. You become part of the child, you become part of the pathology. And when that pathology is child abuse, you become part of the child abuse. When it's spousal abuse, using the child as a weapon, you become part of the spousal abuse. So these forensic psychologists are child abusers and spousal abusers. The psychologists are abusing the children and abusing the parents. The psychologists are. And no one is stopping it. No one's overseeing that. Everybody's just letting it happen. And then you bring me their defective reports so that I can try to stop it and correct the situation. Where are the licensing boards? Where is the APA? Where is the AFCC? Where is anybody overseeing this failed approach? Nowhere to be seen. There's my rant. Stahl and Simon. Despite clear and convincing argument for the use of forensic model when conducting child custody evaluations, there are still those who argue that the clinically informed approach to child custody evaluations is appropriate and preferable. We strongly disagree with the clinically informed approach. Well, there is your debate right there. Dr. Childress will take 100% exception to what they said right there. I am one that says a clinically informed mindset is appropriate. It goes back to all of healthcare and all of history. Diagnosis guides treatment. This is a pathology. We need to treat it and fix it. And it's 100% appropriate. And the forensic mindset is not appropriate. It's an experiment. It's a failed experiment, and it needs to be eliminated. Debate online. Hosted by a law school, hosted by the AFCC, hosted by the APA, hosted by anybody. This would get forensic psychologists to talk about how wonderful and their forensic custody evaluations are and how they solve things in the family courts. And I'll take the contrary position, say we need to go back to clinical psychology. Let's have a online public debate, moderated debate, and put the issues out there. Everybody can look at them. Everybody can see the issues, and we can make an informed decision going forward. But they won't do that because they know there's no support for what they do, and they don't want to be exposed. So the forensic psychologists who created this experimental new approach to service delivery, forensic custody evaluations, did not inform the subjects of their experiment regarding alternatives to their experimental new approach. Parents and the courts were not informed that they could also seek a clinical diagnostic assessment for the pathology in the family. The forensic psychologists who created this experimental new approach to service delivery of forensic custody evaluations intentionally withheld information about alternatives from parents and the court. Okay, this drives me nuts. Forensic psychologists gave parents and the courts only one choice: their experimental new approach they call forensic custody evaluations. Now, it's very interesting that Stahl and Simon are of the opinion that their forensic custody approach is superior to clinical, but it is not okay for them to withhold clinical services from families because of their false belief, because they get $20,000 to $40,000 for their custody evaluations. And if the court is informed and the parents are informed that you have a choice of a $20,000 to $40,000 custody evaluation that solves nothing, doesn't give you a diagnosis, or you can have a clinical diagnostic assessment for $2,500, 4 to 6 weeks, that returns a diagnosis of possible child abuse relative. Which one is the court going to choose? Which one is parents going to? They're going to choose the clinical assessment. They're going to want a diagnosis of child abuse when child abuse is present. And it's going to be cheaper. It's going to 4 to 6 weeks. They get an answer for around $2,500, $5,000 with a second opinion on it. I think you should toss a second opinion on it, all of them, because there's going to be a disputed diagnosis that you're going to get appealed to another doctor. So put the 2 doctors right up front, get a joint, or 3 doctors, and get a solid diagnosis and treatment plan that the court can rely on. That's what should be doing. It should be going over to clinical psychology. But the forensic psychologists intentionally shut down that path and gave the courts only their experimental new approach because it financially benefited them and it benefited them in their professional career. And all the rest of clinical psychology doesn't care. They've abandoned you. They've given you over to your special psychologists, and they don't care what happens over here. If you threaten the license of a doctor's not going to show up. And so I think it's passive aggressive by the clinical psychologist. I know that's a little bit for me when I wasn't working in the family. I'm not going to come to the family. You threaten my license, I ain't coming over here. And so here, we'll give you these folks, and then we'll just walk away. Hope you're happy. Threatening the license of a doctor. Courts, you're gonna mess with a doctor, Your Honor. Well, then fine, you don't get a doctor. I'm not going to work in the family courts. I'm not going to put my license on the line if you make it dangerous for me to work in the family courts. So then you get these forensic psychologists who are worst imaginable. I hope you're happy. It's a passive aggressive thing on the clinical psychologists because you're threatening their license. And so we just don't come and we don't care. So good luck to you. But the idea that the forensic psychologists have given the courts only one choice, and it's an experiment, is just sends me off just elsewhere. I just go insane off of that. If the experimental new approach is successful, then the creators reap the financial rewards and benefits of professional status. If it is unsuccessful, however, then the lives of thousands of children and their parents will be irrevocably destroyed. So from its inception, all the rewards for their experiment went to the forensic psychologists, while all the risks were borne by the children and families. That is unacceptable. The risks should not be borne by the experimental guinea pigs you're working on, and the benefits go to the forensic psychologists. We need outside and independent review. We get it from the Blue Ribbon Commission. They said eliminate it. And I'm a 100. How did this ever happen? How did this ever happen? The negligent neglect of clinical psychology, of the APA, of the AFCC, the unethical practices within the AFCC, all of them, all the AFCC, 40 years. If it's 40 years and they're just the first time learning about all of this, I don't buy it. It's not credible defense from the AFCC on this. They were participants, collusive. Why? Because they're controlled by the forensic psychologists who are making money and exploiting these families and who are stupid and ignorant like a rock. Their approach failed. If it's successful, they get the benefits. If they failed, thousands of children's lives and the lives of their parents are destroyed. It failed. So As a result, the lives of thousands of children and parents were irrevocably destroyed across decades as a result of their failure. And this is a failure of specific people who created this abomination of a model for service delivery. Okay. They tried something, they tried this new experiment, they rode the success of trying their experiment. They got all sorts of money throughout their career for their new experiment. And it was a failed experiment, and they destroyed the lives of thousands of children and thousands of parents as a result. There needs to be a tribunal. Somebody's going to have to explain to me why the licenses of all forensic psychologists should not be pulled, should not be revoked for being participants in child abuse, for being participants in spousal abuse, for being unethical, lazy, ignorant, incompetent, multiple ethical violations, and failure in their duty to protect. Explain to me why failure in their duty to protect, unethical practice, and participating in child abuse because of their um, ignorance and incompetence and unethical practice should not result in revocation of license. Being a child abuser and you're working with children in the family courts, being a spousal abuser, and you're allowed to do that? Really? As a psychologist, you're allowed to participate in child abuse because you're so lazy and incompetent that you don't bother to learn what you're doing? No, I don't think so. I think pull their license. We don't need child abusers in professional psychology. We don't need spousal abusers, and we don't need lazy and incompetent psychologists who don't care about ethics and go off and wind up abusing children and their parents. We no. So explain to me why. Okay, they shouldn't lose their license. Somebody's going to have to explain that to me because from where I sit, they should. So let's talk about the structure for a second, because this drives me insane too. These forensic custody evaluations. Here's the structure of a forensic custody evaluation. They have an opening. Now, just the opening is just sort of all the technical stuff they say, and it's cut and paste. They do in all things. That I'm a custody evaluator, and this is what I do, and so it's just cut and paste for 10, 15 pages. Then they go into and list the sources. And so there's a big list of all the things they reviewed and okay, so that's pretty much just bureaucratic stuff as well. Okay, just listing what you have and what the thing's about. Then they go into their history and symptoms section. That's what it's called in professional psychology, history and symptoms. And now what they do on this, and this is just phenomenally bad. What they do for their history and clinical psychologists, I'll talk to you and I'll summarize in about 3 or 4 pages what your family history is, what the situation is, what's going on, and I will provide a professional level description of it. Now, when I'm supervising an intern or a postdoc, and they be coming back with their intake report on something, as I'm reading their history and symptoms section, and their diagnosis is going to be ADHD, I need to see in their history and symptoms the 6 symptoms of ADHD that's going to qualify for the diagnosis. So in that history and symptom section, we are framing where we're going to wind up with on our conclusions, our recommendations, and our diagnosis. We're presenting the information in a coherent, understandable way and with a professional level of processing of that information. What the forensic psychologists do, though, is they simply audio record the interviews. And it's not really an interview. They just simply talk to the person, the parent, each parent and the child, and they audio record that person's position statement, basically. And then they send that audio recording out to be transcribed and present that transcript, the transcript as their history and symptoms section with no professional processing of the information. And what I want everybody to understand is I could hire a high school student to do what they do. Up to about, if you got a 70-page custody evaluation, up to about page 50, I could get a high school student to do that. You go in, you audio record each of the people, you just let them you say, what's happening? and then you let them tell you what's happening. You get the transcript, and you take the transcript and you take it over and put it into a report type of format. The mother said, the mother reported, the father reported, the child said. It's just a transcript of an audio. Why do we need a forensic psychologist to do that? Why don't we just get the each party just send their position statement directly to the judge, and we'll skip the middleman of the forensic custody evaluator? There is no professional activity present in about 50 pages of a 70-page custody report. And then what happens? Then what do they do after this? They present the transcript of an audio recording of their interview. They then go into the testing section. They typically do, when they include this, they typically do an MMPI and then some other random instruments that have no usefulness and no value about anything. And they're just doing it to give the appearance of doing some sort of professional activity. But I know what this stuff is, and they're not doing any professional activity in these interpretations of these assessments or reports. What you're supposed to do is get testing data back and then integrate it with the rest of the information. They're just doing testing by rote. That's not how you do testing. That's called a fishing experiment, fishing expedition. Unless you have a question to be answered by your test, don't do the test. There's no reason to do a test unless it's to answer a question. But they don't. They just do stuff because it pads their expenses and it gives the appearance, it fools the rest of the public, the general public, and the court that there's some sort of psychological testing going on. No, there isn't. There's no professional level quality of that. I have seen good testing, but typically it's outsourced to a clinical psychologist. So I have seen good testing. Rorschach typically is good when it's done by a good person. I've seen some good Rorschach MMPI combinations but that's done by an outside clinical psychologist who's brought in to participate in the evaluation. But for the most part, it's just a shell game that they're doing with the general public. And then their conclusion. This is where it really gets, so at 50 pages of a 70-page custody report, they'll get into their conclusions. And their conclusions are just personal opinions without the application of professional knowledge. And it's a misdiagnosis based on everything they report. So as I'm going through their transcripts, I mean, that's golden for clinical psychologists. You're giving me the raw data. You're giving me the transcripts of the interview. So I'm just pulling out symptoms and symptoms and symptoms, saying, you're not seeing this, you're not seeing this, you're not seeing this. This is a symptom of that. This is a symptom. And I'm laying out the entire clinical picture. Because when we get to their conclusions, they apply none of that knowledge, and they reach misdiagnosis. They're not even conceptualizing any of the pathology that's involved. They're not applying any knowledge, and everything they come up with is just a matter of their personal opinion. So there's your violation to 2.04. It's at that point that 2.04 triggers. The moment they present their transcripts and we've got all this worrisome pathology and they acknowledge none of it, they see none of it, and they applied no established scientific and professional knowledge of the discipline as the basis for their professional judgments, they're in violation of 2.04. That leads to a question about 2.01. Are they even competent in the diagnostic assessment of delusional thought disorders? No, they are not. I can tell because their transcript, they just missed on all the symptoms of a persecutory delusion. Are they competent in the assessment of attachment pathology? No, they are not. I can tell because they just whiffed on all the false attachment pathology symptoms that were being reported, that they are reporting. And they don't even realize it's not consistent with an authentic attachment system. And it's a factitious attachment pathology because they know nothing about the attachment system. And they know nothing about delusional thought disorders. And they know nothing about personality pathology. And they don't need to know anything. They don't care to know anything. They are lazy because no one is enforcing standards of practice in the family courts. And day after day, this is what I do. Years I've been seeing this low quality of professional services being delivered by forensic psychologists. And I say it. Does anybody do anything about it? Does the AFCC intervene to up their? Does the licensing boards do anything to train the forensics? Does the APA respond to a petition from 20,000 parents complaining about? No one does anything. And so they allow these this low level high school. Seriously, seriously, I could get a high school student to do a forensic custody evaluation. Put that on a debate. Can a high school student do a forensic custody evaluation? Dr. Childress says yes. Get a forensic psychologist to say no. What are you doing that requires a psychologist in your custody evaluation? The testing? Well, outsource the testing to a psychologist. The rest of it could be done by a high school student. That is how phenomenally low the professional practices in the family courts are. Now, this is a rant, personal rant on me. Robert's apperception test for children. They're doing MMPIs that are pretty much irrelevant, and parenting satisfaction inventories that are entirely irrelevant, and stray little measures that they toss on for whatever personal belief they have that are entirely irrelevant. Not one of them is using the Roberts apperception test for children over 40 years of forensic psychology. Let me tell you about the Roberts. I love the Roberts. As a clinical psychologist, when I was in the school system and I get a behavior problem kid out of the school system, I would toss a Roberts on that. If I've got a IQ test and a achievement test, but there's some emotional kinds of stuff, family stuff going on, involved in that, I'm tossing a Roberts into the assessment protocol. It's a projective test. They don't call it projective, but it kind of is. But it's a norm-based one, so it's got norms associated with it. So what we do is we show the kid a card. I love my Roberts. I don't have any other test. I don't even have the book. Yeah, I do have the book. But I don't do tests anymore, but I still keep it because it's such a good measure. It's like, oh my gosh, I'm on my Roberts. And so you show a kid a picture, and it has various pictures of various scenes of family situations or peer situations. Each one will provoke for a different type of response. It will pull for, it's called. It will pull for a type of response. But then what the Roberts did, is they put it through a group of 1,000 children and got what 1,000 children say on these various cards. And so it's not the specific answer, it's how the child's answer compares to a norm reference group. So the children's stories, you ask them to tell a story with a beginning, a middle, and an end. Tell me what everybody is thinking, feeling, and doing. And then if they don't quite get that the first card, you give them a few prompts. And then by the next card, you just let them go and tell me beginning, middle, and end, thinking, feeling, doing. And so the child's stories are recorded and then scored. So they're scoreable. And so it's not just an opinion I have about what they no, I score up their answers based on objective criteria. So this gets scored that, this gets scored that. For the presence or absence of specific characteristics. Then there's norms grouped by age, are based on a sample of more than 1,000 children and adolescents ages 6 through 18 from all 4 U.S. census regions. The sample is representative in terms of gender, ethnicity, and parental education. And so that's called a norm reference test. Those are excellent, because it's not just giving you a score. You can actually, so it's like an IQ test. It's like the MMPI. MMPI is norm reference. So you can take that and get what normal people or typical people would say and what's deviant on this. So same thing here about these wonderful cards that are showing conflicts, and you get stories about that. So you get to see inside the child. So now listen to what we get to see from the Roberts here. Okay, so this is from the website. You can go up to the publishing site website and get this. So first off, they look at available resources, emotional, psychological resources from the child. The support from self. Do they feel they have enough support from themselves? Their ability to advocate for themselves. Support from others. Are they getting support from others? Reliance. Do they rely on others? And limit setting. How do they handle limit setting? But wait, that's not all. We also get scores on problem identification. Do they recognize the problem? Are they able to describe the problem? Is there clarification of what the problem is? Are they able to define what the problem is? Are they able to explain what the problem is? But wait, that's not all. We also get resolution of the problem. Is there a simple closure, easy outcome, um, or do they report an easy, realistic, positive outcome? Is the process described in constructive resolution? The process described in constructive resolution of feelings in the situation, elaborated process with insight. Wouldn't that be so useful to understand about these kids? Then why hasn't, in 40 years, a single forensic psychologist conducted the Roberts with these kids? Why aren't we getting routine reports out of the forensic psychologists about the Roberts for these kids? They're just lazy. They're just lazy. They don't care. They just do their same thing. These are the worst psychologists imaginable. On a scale of 1 to 10, they're like negative 100. They are absolutely, you might as well go, you get better off going to your car mechanic to getting a custody evaluation because they're going to at least have some common sense. These ones, like that. So, and then you get the best is an elaborated process with possible insight. So we can take a look at how they identify problems, how they resolve problems. But wait, that's not all. We also get scores on their emotions. We get scores on anxiety, aggression, depression, and rejection. Oh, wouldn't that be so useful to see inside the kid about what their level of anxiety is, what their level of aggression is, what their level of depression is, what their level of rejection is? I think so. Conduct the Roberts and you'll get that. And do you see the Roberts on any of these? No. Unbelievable. Makes my head explode. But wait, that's not all. We also get the outcome. So we get, do they have unresolved outcomes? Do they have non-adaptive outcomes? Do they have maladaptive outcomes or unrealistic outcomes? But wait, that's not all. We also get unusual and atypical responses, such as refusal, no score, and atypical categories. Now, when I do the Roberts, okay, so you score it up and you get your really good scores, but the response to these cards, because it's not a projective test where you're projecting stuff in, it is, but because it's a scoreable. Because there's actual scores, so we're getting insight into the things, and so if the child indicates energy, that could be anxiety, or if they indicate pain or hurt, that could be a depression score, and boo, and then we compare it to a norm reference group. So it's more like the MMPI in that respect, but it does capture the projective kinds of things where the child's looking at a particular situation. So let's take a look at this one. This is going to pull for certain things. The child's going to respond with certain stories about that, and each card is going to pull for something different. And so I can, as a clinical psychologist, look at their answers and get kind of insight about mom or dad or the family situation based on their story projectively. But in addition, the most valuable information I found is when they reject a card. When I show them a card and they just say, no, I don't have a story, or they give a real minimal story. And here, card before, they're telling me a wonderful story. They get this one card, they go, I'm not telling a story on that one. Well, whatever that card is pulling for, hit something. Okay, so what is the picture? What is that card showing the child that is boop, triggering the child? And so that's a very useful clinical indicator. The ones that the cards they reject, and typically I'll see them still ripple that emotional discomfort on a card or two after that. So they reject a card, and then the next card is still a little, I can feel a little problematic, and then they're back into the storytelling by the next card. So it's very interesting. The Roberts is excellent to get emotional picture of the kids. So why haven't this been used in forensic psychologists for 40 years? Because they don't care. They're lazy. They're ignorant. They're like a rock. Now, do I think they should be incorporating the Roberts? Yes and no, because I think that forensic custody evaluation should be gone entirely. No, we don't need them. Gone, gone, gone. Now, if you go into a clinical assessment and you need this information, then collect the information. It's valuable information. If there was a research on the pilot program for the family courts, absolutely include the Roberts on your research protocol. If you establish a pilot program for the family courts, with university involvement for the evaluation research. Include the Roberts in your data collection. It's going to give you wonderful, wonderful information. So now let's just run down the ethics code, the ethics violations within forensic psychology. Unbelievable. So we have the primary ethical violations: violation of 2.04, bases for scientific and professional judgments; violation of 2.01, boundaries of competence. They're not competent in delusional thought disorders; they're not competent in attachment pathology. And 9.01, bases for assessment, that because they did not apply the established knowledge and don't know the established knowledge, their report and recommendations, including their diagnostic and evaluative statements, um, is not based on information and techniques sufficient to substantiate their findings. Violation of 9.01, basis for assessment. They're also in violation of Principle D, justice, because that guarantees equal access and equal quality of services, and there is no equal access when your custody evaluation costs $40,000 and you people can't afford it, and there is no equal quality because there's no inter-rater reliability to these. So they're in violation of Principle D on both counts of Principle D. The secondary violations are 2.03, maintaining competence, but I don't talk about that much because you can't maintain competence if you're not competent to begin with. But 2.03 is in there, they're not maintaining competence. And 3.04, avoiding harm. But by the time I get avoiding harm, I'm just like overwhelmed because we got all the other ethic. But yeah, avoiding harm. They're harming parents and their recommendations, and that's unethical. And they are in violation of their duty to protect. And the duty is red because that's a legally obligating duty for all doctors. We have two legally obligating duties: duty of care and duty to protect. Okay, and so there's three types of dangerous pathology: suicide, homicide, and abuse. Child abuse, spousal abuse, elder abuse. Any one of those dangerous pathologies triggers our duty to protect. Here we're talking about possible child abuse. The child and the allied parent are making the allegations that the targeted parent is somehow abusive, either by overtly or by implication, and the targeted parent is making the allegation that the allied parent is psychologically abusing the child, creating a persecutory delusion and factitious attachment pathology. So we got a child abuse one way or the other. Their duty to protect obligations are active. They should be returning a diagnosis of child abuse in all cases of custody conflict, because that's the only thing that causes a severe attachment pathology is child abuse. So all forensic custody evaluations, all of them that do not have a diagnosis one way or the other regarding the child abuse in the family, are failing in their duty to protect. And if they haven't come up with if they don't think there's child abuse range, they should at least be discussing the scope of that and why they haven't made that diagnosis of child abuse. What criteria were not met for child abuse and for spousal abuse? There's two dangerous pathologies. And that's now the parents can't defend themselves because they say it's not about you, it's about the child. But the psychologists have duty to protect obligations for the child and for the targeted parent, and the spousal abuse of them using the child as a weapon. So we got two duty to protect obligations, and the forensic psychologists are failing both of them. They should lose their license. Somebody explain to me why they shouldn't lose their license for this level of lazy, ignorant, incompetent, unethical malpractice, where they become participants in the spousal abuse and participants in the child abuse, and they are the psychologists, and they're child abusers and spousal abuse. Pull their license. Now, you pull one license of one forensic psychologist, I guarantee you will get competent services in the family courts. But until we hold them accountable for their lazy, ignorant, incompetent malpractice, they continue to do it. Final thing. No, not quite the final thing. Final thing on just what sends me up the wall is there is no inter-rater reliability for forensic custody evaluations. And we know from psychometrics of testing, we know for a fact that if an assessment is not reliable, if it does not give you consistent results, it is not a valid assessment of anything. That is axiomatic within assessment. If the assessment is not reliable, it cannot possibly be a valid assessment of anything. If I measure your intelligence this week and you come out brilliant, 140 IQ, next week test retest reliability. Next week I give you the same intelligence test and you come out as like a carrot. You come out as like IQ of 5. Okay, so now 1 week you're 140 and the next week you got an IQ of 5. That's not a reliable assessment of your intelligence. It keeps giving me scores all over the place. So it cannot possibly be an assessment of your intelligence because that doesn't bounce from brilliant um, to a carrot within a scope of a week. That's test retest. There's 4 types of reliability: test retest, alternate forms. We give 2 different variants of the same assessment. Internal consistency, split half. So we take a test and we look at one half compared to the other half to see if they're getting us the same results and they're reliable. And then inter-rater reliability. For an interview type thing, like a forensic custody evaluation, the appropriate form of reliability is inter-rater reliability, which would mean 2 forensic psychologists would reach the same conclusions based on the same data. What's the inter-rater reliability of forensic? 0. They have none. 2 different forensic psychologists can reach entirely different conclusions based on exactly the same data. If it's not reliable, which it isn't, it can't possibly be valid. All psychologists know this. We were trained in this in our course on assessment. If it's not reliable, it can't be valid. So my first question on cross-examination is, what's the inter-rater reliability of forensic custody evaluations? Well, there is none. Well, then there can't be valid anything. They're just personal opinions of the custody evaluation. They don't even apply knowledge, and they're so biased because the control for bias is the application of knowledge. If you don't apply knowledge, then you got all sorts of counter-transference stuff coming from your own childhood, from you don't like your spouse, you had a bad spouse, so now you're talking to a woman and she triggers all those kinds of things about your own marriage. What's the control for that? How do we get that bias out? 2 ways. One, we apply established knowledge so that way we limit the personal opinions that get in there. So everybody's applying the same thing about cross-generational coalition, diagnostic criteria for delusional thought disorders, attachment pathology knowledge. We're all applying the same knowledge that takes out the personal bias. But then the second level that we put in to control bias is second opinion. So if you have your biases, everybody has their biases. So you have your unconscious biases, but now we get a second opinion who has different unconscious biases. Their biases will control for yours. Yours will control for them. That's how we deal with, or one of the ways we deal with potential bias is second opinions. So I think second opinions should be routinely done. Why haven't forensic psychologist been doing for second opinion? Well, because you can't do a second opinion on a custody evaluation. $20,000 to $40,000, 6 to 9 months to do. You can do a second opinion on a clinical interview, but they don't give you the option of a clinical interview, a diagnostic. Nope, you don't get that. Nope, we do only custody evaluations, and that's all you get. Unbelievable. Unbelievable. Get rid of them. Get rid of them. All of them should lose their license. All of them. Forensic custody evaluations are a failed experiment in service delivery to a vulnerable population. It has been 40 years of failure. Enough. I'll debate this with anyone, anytime. If a forensic psychologist wants to say after 40 years, they're far from mature field, it's in its adolescence, has been solving the pathology, I'm more than happy to debate that. I don't think any person finds that credible, that forensic custody evaluations are in any way successful. Blue ribbon commission on forensic custody evaluations lack scientific or legal value, harmful to children, and should be entirely eliminated from the family courts. Clinical psychology, diagnosis and treatment needs to return to the court-involved family conflict, but we won't come back because it's too dangerous over here, so we got to get a handle on that. We need a standardized, structured, standardized diagnostic assessment and treatment protocol that everybody agrees to and that is of the highest caliber and that results in an accurate diagnosis. That's how you keep your forensic psychologist or your clinical psychologist safe. You get us a standardized diagnostic assessment protocol and treatment protocol. And one way you can do that, I give you that. Okay. Attachment based parental alienation, or call it Bob, call it whatever you want, foundations, diagnostic checklist, parenting practices rating scale. Um, so you can get one from me, a standardized, clear, and I think it should be done all the time, every single time, routinely. Diagnostic checklist for pathogenic parenting, parenting practices rating scale. Just document what the symptoms are. You can agree with them, you can disagree, you can argue about. Just document what they are. We have one litigant, the targeted parent, who wants you to document what the symptoms are using diagnostic checklist. So go ahead and do that routinely, and then everybody can look at the data and then decide what to do. But the forensic psychologists say, no, I'm not going to tell you what the symptoms are. Unbelievable. I'm not going to tell you what the symptoms are. I'm not going to diagnose what the pathology is. And they're allowed to get away with this. So with that, I'm going to head off to my Sunday, which happens to be jumping into a forensic custody report like this, and it's just, I actually have a full head of hair. I've lost it because of this sort of stuff. So with that, I'm headed off to my Sunday. Good luck, everybody. Happy New Year. So we will talk to you later.